Today our lecture topic will be diuretics. So what is diuretics? Diuretics are the drug which which causes production of more urine by absorbing water from the renal tube. So diuretics may increase volume of urine, which is called diuretics. So we can classify diuretics according to side of action. Diuretics which act on the PCT. PCT for proximal convoluted tubule. Then leukopendy, in which portion ascending limb of ascending limb of ascending limb of leukopendy leukopendy. Then we can mention early part of distal convertible, early part of early part of early part of distal convoluted table, distal convoluted convoluted table, convoluted table. And next, we can distal convoluted table or DCT is two part, early part, late part. But we mention here only early part of distal convoluted table. Next part, next portion we will be mentioned uh, collecting table, collecting table or collecting duct, collecting table or collecting duct, collecting table, collecting table or collecting duct, collecting duct or city. We can tell in short, which is called city, and it's DCT for distal convertible. So now we'll mention diuretics which acts on the PCT, which acts on the PCT. Now we'll mention the diuretics which which are act on the PCT, which are act on the PCT. Okay, so let's start. In PCT, here acts osmotic diuretics, osmotic diuretics, osmotic diuretics, and next carbonic 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 anhydrase anhydrase inhibitor 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 inhibitor. Next next sodium glucose sodium sodium glucose sodium glucose 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 transporter 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 inhibitors. In short, I had remembered SCAOS. C for carbonic anhydrase, O for osmotic diuretics, and S for sodium glucose transporter inhibitors. So, which are osmotic diuretics and which are carbonic anhydrase inhibitor and which are sodium glucose transporter? Osmotic diuretics are osmotic diuretics. Osmotic diuretics are which are osmotic diuretics? Osmotic diuretics are glucose, 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 inulin, mannitol. Which are osmotic diuretics? Which are osmotic diuretics? So which are osmotic diuretics? Glucose, glucose, insulin, mannitol, and urea. Glucose, insulin, mannitol, and urea. Which are carbonic anhydrase inhibitors? Carbonic anhydrase inhibitors are carbonic anhydrase inhibitors are carbonic anhydrase inhibitors are acetozolamide, all are zolamide, acetozolamide, 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 benzolamide, benzolamide, acetylamide, benzolamide, dorzolamide, which are carbonic anhydride inhibitor. Dorzolamide, which are carbonic anhydride inhibitors. Now, how can I remember? AC, AC, ACCA, CA for carbonic anhydrase, AC for acetylamide, benzolamide, acetolamide, benzolamide, dorzolamide. Now, sodium glucose transporter inhibitors. Now, sodium glucose transporter inhibitors. So, which are sodium glucose transporter inhibitors? Canagliflozin, 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 glyphosine, dapagliflozin, dapagliflozin, empagliflozin, empa, empagliflozin, anagliflozin, dapagliflozin, empagliflozin, empagliflozin, empagliflozin. Now, now the drug which acts on the ascending leaf of leucophilic. So, which are drugs which acts on the ascending leaf of leucophilic, which are called loop diuretics. Which are called loop diuretics. So, which are loop diuretics? Loop diuretics are furosemide, 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 torsemide, torsemide, and last we can mention here ethylgranic acid, ethylgranic acid, ethylgranic acid, ethylgranic acid. Next we'll mention diuretics which acts on the early part of distal convertible or DCT, which here all thiazide and thiazide and thiazide non-thiazide here acts thiazide and non-thiazide diuretics. So with thiazide diuretics, which are thiazide diuretics, which are thiazide diuretics are chlorothiazide, chlorothiazide, chlor, chlorothiazide, chlorothiazide, hydrochlorothiazide, 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 then chlorothalidone, 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 shit. So I again uh, read it here. So which are thiazide diuretics? Thiazide diuretics are thiazide diuretics are thiazide diuretics are chlorothiazide, 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 hydrochlorothiazide, 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 and chlorothalidone, 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 and which are non-thiazide and polythiazide polythiazide, polythiazide, which are non-thiazide, which is called you can remember only here indapamide, indapamide, which is non-diuretics. Now diuretics which acts on the alking table or alking duct. Here we classify two types. Uh, Mainly here acts only adds in potassium aspirin diuretics, potassium aspirin diuretics, diuretics, diuretics. So what do you mean by potassium aspirin? Potassium aspirin means two gas two gas two gas potassium in the bloodstream. So which causes hyperkalemia, now uh, which are potassium diuretics? Potassium aspirin diuretics. Number one, we can classify is two types. Two types. One is aldosterone, aldosterone receptor, aldosterone aldosterone receptor antagonist, aldosterone receptor antagonist, antagonist, which is spironolactone, 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 which is spironolactone. And next will be sodium channel blocker, sodium channel blocker, channel blocker. It's block sodium channel, which is you can remember here only one name, which is immunolorite, immunolorite, okay, which is called here collecting table or collecting duct, diuretics, the diuretics which acts collecting table or collecting duct, which is called potassium aspirin diuretics, potassium aspirin diuretics. So we can end the lecture here. Thanks for watching.